The situation is very different in India. That's where a new double mutant variant is suspected to be behind that country's surge in COVID-19 infections. In fact, the public health experts are facing a new wave of cases that have reached record levels and made India the second worst hit country after the United States in the world. Now, the World Health Organization has confirmed that it's tracking the variant amid concerns that the mutations could stunt the ability of vaccines to curb the spread of the virus. The new variant has already spread to at least 10 other countries. To help us better understand this variant and what it potentially means for South Africa, let's bring in Infectious Diseases Specialist Dr. Richard Lessells from the University of KwaZulu Natal, joining us now via our video link. Doc, thanks very much for your time. It's great to have you on the program. I wonder, before we speak about this variant, whether we could just get your sense of what you make of the spiraling infection rate in India. News just in this morning that 300,000 new infections were picked up in the last 24 hours alone. That's the highest than anywhere ever.
Yeah, good morning. I mean, it's very distressing to see what's happening there, isn't it? And we're seeing pictures and hearing stories now of how bad things are. The hospitals are under extreme pressure. As you mentioned, the oxygen supplies are under extreme pressure. I mean, there are some similarities, some echoes to our experience in kind of December, when we saw that just very rapid rise in cases at the beginning of the second wave. And really that's what's happening in India. They're well into the second wave now, and they're just seeing a very steep exponential growth of the epidemic. And like you say, there's 300,000 reported cases a day, but like we tell you here a lot, that's probably a significant underestimate of the true number of infections. And so it's likely there's probably several million new infections every day across India. So wow. It's very worrying what we're seeing there.
Yeah, and I remember at the onset of the outbreak, there were concerns being raised about how this pandemic would go about developing in different parts of the world. India was one of those countries flagged as one to closely monitor, and sadly it appears that those things are now manifesting. Talk now of a new double mutant variant. What does that mean?
Yeah, I mean, just on your first point, just to pick up on that, I mean, I think, again, we've seen some similarities. That India had this first wave, and then infections settled, and there was a little bit of complacency set in, and there was a little bit of misunderstanding about how these epidemic waves happen. And so there was a feeling that India had got over the worst. And again, there's some echoes with us here in South Africa and many other countries where they relaxed a little bit too much, I think. And the virus has then come back to really cause devastation. In terms of the variant, I think at the moment we're still unclear to what extent that is driving this second wave of infections. I think you know now well about the genomic sequencing because you've heard a lot of it from us here in South Africa. It's quite patchy in India. So they're kind of sequencing fewer than 1 in 1,000 of their cases. So the information that we get is not necessarily telling us the full picture of what's happening. A lot of people have been scared by this phrase, the double mutant. Essentially, when they're referring to a double mutant, what they're saying is there are 2 mutations in the spike protein receptor binding domain. Now, again, this is getting technical, but if you remember back to us talking about the 501YV2, there are 3 mutations in the receptor binding domain in 501YV2. So if we'd wanted to also scare everybody, we could have called that a triple mutant. So the double mutant that's being described, it's just another variant. It has some similarities to the 501YV2 and some similarities to other variants around the world. But as I say, we don't yet know the full significance of it, and we don't really know to what extent that is driving this terrible rise in the cases.
Yeah. What we do know is how this could complicate the fight against COVID-19 because of how these spike protein receptors respond to the kind of candidates of vaccines we have at our disposal. In the case of the variant found here in South Africa, we've already learned that AstraZeneca, which ironically is manufactured in part by the Serum Institute of India, doesn't have enough efficacy against mild illness here in South Africa. What kinds of concerns does this raise for India and by extension for the rest of the world? Because we know that a pandemic out of control anywhere on the planet is a threat for communities elsewhere in the world.
Yeah, you're quite right. I mean, these are concerns, and based on what we understand of this variant and where the mutations are, it might be expected that they would have some effect on the binding of the antibodies that are either produced naturally after an infection or produced by the vaccine. But looking at that variant, it's probably unlikely that it would be a bigger problem than, say, the 501YV2. Because there are fewer mutations at the kind of key sites where these antibodies bind. So we need to do the experiments, we need to understand that, but it's not a huge concern at the moment. There was some evidence out yesterday that one of the vaccines being produced in India, not the AstraZeneca, but one called the Bharat Biosciences, there was some report that that had been shown to be effective against this double mutant in the laboratory. But we need to see the full results of those experiments and to understand more.
I always ask this question at every opportunity I get. The real fear around the virus spreading is the opportunity for mutation to take place, and India is just one example of that. How close are we to developing a candidate of vaccines that would be able to essentially respond to these variants in a way that doesn't cause any worry or trouble for us? Because my understanding is that currently the vaccines at our disposal didn't necessarily have variants in mind when they were being manufactured or created.
Yeah, exactly, because we didn't know how this virus would evolve over time. But what you've seen is the vaccine developers have very quickly been able to produce updated versions of their vaccines. So actually the first of those from the Moderna in the United States, that's already being tested in clinical trials, the vaccine that's been modified specifically on the 501YV2. And what you're going to see over the next few months is most of the other vaccine developers getting their vaccines into the kind of early clinical trials as well. And so I'm very optimistic that's going to happen and that's going to become routine, that if we see further evolution of the virus and further concerns, then these vaccines can be modified. And the important thing is to then check that they remain safe and are effective against all the circulating strains. But as you said, the priority, as always, is to shut down transmission of this virus and to stop transmission in our communities, because that's what stops the virus evolving. And that's what we've seen in India, we're seeing in many other countries at the moment, going through these similar surges again. We're seeing that transmission was not slowed down enough, and the virus had an opportunity to start surging again.
For us here in South Africa, during what is perceived to be some kind of lull in our fight against COVID-19 as we watch the situation unfold in India. Dr. Richard Lessells, thanks very much indeed